My name is Grafstein. I'm an emergency physician. I've recently taken on the role of Regional Medical Director and Head of Emerge for Vancouver Coastal Health, Providence Health Care. I like all aspects of medicine. That's one of the great things about emergency medicine, and that sort of dovetails into the kind of research that I've been involved with. I think one of the things that has been a problem in healthcare is there's been very difficult to evaluate what you do, and that by having good data and the ability to access it, you can measure what you do. So most of what I've been involved with for the last 15 years is what I would call loosely health services research. It's a big focus on gathering and collecting administrative data around the patient's encounter in the emergency department and using that to help determine what happens to patients during their stay. I think the things that we've done most recently are the things that I'm most proud of, and that's linking with outcomes, that is visits to other emergency departments or revisits to St. Paul's, or even whether or not patients have died, to look at how our treatment of patients is impacting them and whether or not we're doing good things. We see a large number of patients from the downtown east side. These are some of the poorest people and the most, I would say, socially challenged people in the country. Some of the research that we've been able to do recently is looking at the issue of equity. It's one of the things we always worry about, that is, do we treat all patients the same regardless of whether or not they live in Shaughnessy or live in the downtown east side? There is a provincial patient satisfaction survey, and we were able to look at that data, and we're able to survey homeless patients, patients who wouldn't have a phone or an address, who wouldn't really have answered those regular satisfaction surveys, to understand the kind of care that they're receiving and whether or not they're satisfied with that care. And I'm happy to say that the care is equal, and equally good. That patients who come to St. Paul's Emergency Department, they enjoy very high level of patient satisfaction.
I think he just has a self-driven satisfaction of achieving the best he can, and I think it's not accolades from other people that drives him. It really is an internal drive that motivates him to be as best he can. He's got tremendous energy, tremendous drive, and he will do things above and beyond what other people would normally do. And I think it's really driven, it's certainly not driven by money. It's not driven by any sense of needing to be in a position of high position. He does this for what he believes in, it's going to improve patient care. And I think he's just so tenacious around ideas that he's able to work through a problem that other people would not be able to.
I like to think that some of the research that we've done, looking at things like patient satisfaction, the things we've done to improve the time to physician, the things we've done to shorten the time in the emergency department, have all resulted in really a more patient-centered care, more patient-focused care. It was a tremendous honor to be selected, and I want to thank the members of my group who nominated me, and I will just say thank you and tell you just how honored I was and happy. Thanks.